All this interest in vaccines as variants become the dominant strains in Alberta, now making up about 57% of all active cases.
When you're dealing with hundreds of thousands of doses, 2.3 million people who are eligible, a hugely diverse province, and 1,300 pharmacies, plus AHS delivery, plus First Nations administration, and so on, it's extraordinarily complex, and I can imagine in that complexity that maybe some pharmacies don't have adequate supply.
Jason Kenney says there are no plans to prioritize clinics over pharmacies for AstraZeneca doses. The Premier and Chief Medical Officer of Health say they're watching for a possible jump in cases from the Easter long weekend, and if closing indoor dining and other measures will cause a dip as they look at what restrictions to put in place.
We are continue to be very concerned about these high numbers, 1,400 cases a day at this point. The rate of growth seems to have come down a little bit, so it's too early to take that to the bank.
The province reporting 1,345 new cases. 816 are variants of concern. There are 18,481 active cases in the province, with 8,098 of those in the Calgary zone. 476 people are being treated for COVID-19 in hospital, with 105 of those patients needing intensive care. 5 more deaths have been reported, bringing the provincial total to 2,048. Kenney also saying he agrees with BC's measures to prevent interprovincial travel.
We have seen a number of the very contagious P1 Brazilian variant cases we know come to Alberta from travel from British Columbia. It looks like when the party was shut down in Whistler that some of it moved to some of Alberta's mountain resorts.
The town of Banff, now the province's COVID-19 hotspot for cases per capita.